dentin and the infected dentin. Only the infected dentin will be stained and we can remove that so that the affected dentin can be left behind. So this caries reductor dye is from Curare. Everyone can make use of it. It's really working good. In this particular case, the arrow mark shows a dentinal crack. A dentinal crack can always be seen only under high magnification, and this dentinal crack is the primary reason for patients complaining of severe sensitivity when they bite hard foods like guava seeds. So when we bite hard seeds of guava or uduthamparappu, thalichukotna uduthamparappu, when we eat that, suddenly a shooting pain comes and we dentists have no explanation why that comes. The reason is that there is a sharp dentinal crack line, and here in this picture, actually it is very clearly, I have taken a picture but we are unable to see unfortunately, that dentinal crack must be sealed. So the next picture is how to manage the dentinal crack. Just like in our roof, if there is leakage of water, what we will do, we will put a drill on that crack and we will seal it with plaster of Paris. Similarly, in a dentinal crack, we have to perform something called a crack dam. A crack dam is a preparation on the floor of the cavity, occlusal cavity, where we dig into the crack and we prepare a crack dam. Thereby, the propagation of crack is prohibited. So once I have prepared the crack dam, I started doing a selective etching without touching the dentin. And secondly, after the etching was done, I had done an immediate dentin sealing followed by wallpapering. Wallpapering is a special procedure where we can reinforce the weakened enamel walls. So wallpapering can usually be done with the help of Everex posterior from the company GC. So I recommend you to buy Everex posterior. It's a fiber reinforced composite FRC, which we can use it to strengthen or reinforce the walls of the cavity. So after IDS and wallpapering, this is my final picture, post-operative picture after finishing and polishing. So this particular tooth was carved out with hands into a direct composite restoration. No RCT, just replace enamel and dentin without touching the pulp. So here the vitality of the tooth was retained and the patient can happily eat ice creams or hot coffee. She can know the difference between the puffs and the murk. So consistency and temperature sensation was retained for this patient, and she will be lifelong a happy patient because we have done a regenerative work here. So this is my first case. So this is the post-operative and pre-operative radiographic picture of the same girl. So this is how she had come, and here you can see the crack dam, how the composite has flown into the crack dam. It may appear as though the access is perforated, that is the access cavity is open. Actually the access cavity isn't open. Since it is a 2D image, this appears as though the composite has gone into the coronal pulp chamber. So now, what if we had done a root canal treatment for a 12-year-old girl? This would have been her condition. So the tooth would have become very brittle, and every RC treated tooth maximum can spare up to 20 years. Because a RC treated tooth is a lifeless tooth, what we will do in order to protect the RC tooth, we will give a crown. By giving a crown, we will be unnecessarily ditching the margins of the adjacent teeth, thereby making the adjacent teeth also a scapegoat for future caries progress. So the vital pulp therapy really works good for younger population. So this is a very good article. I think everyone must read this article. So this article clearly says what are the biomechanical property alterations of a root canal treated tooth. So this article says a RC treated tooth has got very little fracture resistance, thereby making the tooth more brittle. And another study, this is a German article, you can get it, it is an open access article, you can get it for free. This article clearly says that an RC treated tooth requires an occlusal load providing a 2.5 times higher force compared to the vital teeth to provoke a proprioceptive reaction. So a RC treated tooth loses the pulpal proprioceptors. Thereby the RC treated tooth needs 2.5x times more force to sense an object.